All right, a very good evening to all of you. A very good evening to all of you. A very good evening to all of you. So, how is the audio visual, guys? Can I go ahead? All right, so can I go ahead, guys? What is okay? How is the audio visual? How is the audio visual? Can we go ahead? Please write in the chat box, guys. Can I go ahead? Guys, how is the audio visual? All right, so guys, now I'm starting with the block 3. Now I'm starting with the block 3 wrap up, and in this we are going to cover about we are going to discuss about vaccines. We are going to discuss about respiratory infections and TB and NTEP. So we are going to do the wrong question analysis, which we discussed in our quizzes, in our Telegram quizzes, and we will be discussing the keywords which are important for your exam, as usual, images and rapid fire. Right now, coming to first question, the first question is, according to national immunization schedule, at what age is the first dose of pentavalent vaccine typically administered? So guys, pentavalent is typically administered at 6 weeks. So the correct answer here is 6 weeks. 6 week is the correct answer here. Right? 6 week is the correct answer here. So I think this is the easiest question, guys. This was the easiest question. Now there is a 18-month-old child, no prior vaccination history. The child is otherwise has no contraindication to vaccines. Which of the following should be administered? Which of the following should be administered? So here I want to tell you that after 1 year of age, BRIP vaccines are not given. After 1 year of age, BRIP vaccines are not given. BRIP means BCG, rotavirus, IPV, pentavalent, PCV, pentavalent and PCV. So here the correct answer is MR. MR is the correct answer here, because this cannot be given. Now coming to next one. A 3-month-old infant receives rotavirus vaccine. So guys, after rotavirus vaccine, the most likely side effect is diarrhea. It is diarrhea. Diarrhea is the most common side effect after rotavirus vaccine. So here the correct answer is diarrhea. I do agree, intussusception is there, but intussusception is not very common, although it is seen after rotavirus vaccine, but intussusception is not very common side effect. Diarrhea is very common side effect. Vomiting is very common side effect. Now, a healthcare worker is preparing to administer vaccine to children at Anganwadi center. She notices VVM. What is VVM? Vaccine vial monitor. Vaccine vial monitor. It does not tell us about expiration date. It does not tell us about dosage instruction. It does not that the vaccine has been adulterated. It does not tell us about the adulteration of vaccine. Here the correct answer is storage temperature, because if for a very prolonged period the vaccine has been in a very high temperature, then we get the changes in vaccine vial monitor. So guys, if I talk about vaccine vial monitor, so something like this is a vaccine vial monitor. If so, here we have an inner square and outer circle. If they both are at same color, if they both have same color, do not use the vaccine because vaccine is now in third stage. If the inner square is darker than the outer circle, now the vaccine is in stage 4. These two stages we need to discard. So VVM tells us about the temperature, storage, and if it is same color, if the square and circle have same color or darker, discard it. So this need to be discarded. Here option B is the correct answer. Right now, a 1-day newborn baby is to receive BCG. Alright. So how many of you marked this question 0.1 ml intradermally? How many of you marked this? How many of you marked C and how many of you marked D? Write in the chat box quickly. So how many of you marked C? How many of you marked C? Everyone, please write in the chat box how many of you marked option C. Actually, the correct answer here is option D, because the keyword is 1-day newborn. 1-day newborn, guys, I'll tell you. So from birth to 1 month, the dosage is 0.05 ml intradermally. From 1 month to 1 year, the dose is 0.1 ml intradermally, and in India after 1 year it is not recommended under national immunization schedule. Right? It is not recommended under national immunization schedule. So don't forget this point, right? This is important. Now, a healthcare worker is transporting vaccine. Guys, if you have noticed in these questions in our daily telegram quiz, I am also giving you case-based scenarios, right? Case-based scenarios, they are the future of MCQ in Indian NEET-PG exam, right? In our DVT discussion on DAMS Delhi YouTube channel, in our DVT quiz, in our daily telegram quiz, I'm trying to incorporate the case-based questions, right? They are important. Now, so this is the case about ice pack. Ice pack should be in direct contact. No, absolutely no. In fact, this is a precaution we need to take. Ice pack should never be in direct contact of vaccine. Ice pack should go conditioning. Conditioning means, guys, I'll tell you the meaning of this. Why the answer is option B. Option B is the answer. I'll tell you why. Ice packs are not necessary. No, this is not correct. Ice packs are necessary. Ice pack should be, no, this is also not true. Guys, listen. So we freeze the ice pack. What is the temperature when we freeze? The temperature is -10 degree or -15 degrees Celsius. What temperature you need for the vaccines? 2 to 8 degrees Celsius. So when we take out the ice pack from the deep freezer, the temperature is in minus and we need 2 to 8 degree. So we keep the ice pack for some time so that the temperature is at 2 to 8 degrees Celsius, right? So the temperature is at 2 to 8 degrees Celsius. That is why option B is the correct answer. In my every face-to-face class, I discuss about ice pack. This is important. Now, I have one question from all of you. One question from all of you. What is the capacity of ice pack? capacity of ice pack? Please write in the chat box. If you are attending this class, if you are attending this discussion live with me, write in the chat box about the capacity of ice pack. How many liter of water can be there, or milliliter of water can be there in ice pack? Please write in the chat box. Now, at 6 weeks, which vaccine you recommend under national immunization schedule? BCG, OPV, no, this is at birth. DPT, Hib and PCV. Guys, we don't give DPT separately, right? So this is not the best answer here. The best answer here is Rota, IPV and pentavalent. Rota, no, Dr. Ritik Garg, the capacity is 320 ml, not 200 ml. Dr. Akash is right. Dr. Surbhi Patel is right. It is 320 ml. Right? Yes, Dr. Ritik, 300. You can say approximately 300, but to be precise, 320 ml. Now, I think C is the correct answer here. Right? C is the correct answer here. Guys, this logo we have also discussed in DVT. Do not miss your DVT. Do not miss your DVT of vaccines. Do not miss your DVT for health programs, for communicable diseases, for nutrition. Very high yielding, right? Very high yielding. So we have discussed this in DVT. This is UWIN. This is UWIN. Guys, let me explain what is UWIN. You must have heard about MCP card. You must have heard about MCP card, right? आपने MCP कार्ड के बारे में सुना है? सर प्रोब पे बना दो एक वीडियो प्लीज। बेटा आज का सेशन अटेंड कर ले, एक बार आज का सेशन अटेंड कर लेते हैं ना, फिर देखते हैं आगे क्या करना। अभी आज इसको याद कर ले मेरे साथ बस, है ना। अभी आज इसको अटेंड करते हैं और उसके बाद देखते हैं, है ना। अभी सेशन को अटेंड करते हैं, सेशन के एंड में देखते हैं, है ना। चलो, आपने बच्चों सुना है एमसीपी कार्ड के बारे में? क्या है एमसीपी कार्ड? एमसीपी कार्ड है जैसे जैसे बच्चे को वैक्सीन लगती है वैसे वैसे कार्ड पे एंट्री हो जाती है। पर बेटा कोविन हमने एक ऐसा पोर्टल बनाया था जिसमें आपको वैक्सीन कहाँ लगवानी है, कब लगी है, आप डाउनलोड कर सकते हो वैक्सीन सर्टिफिकेट। हमने एमसीपी कार्ड का ऑनलाइन पोर्टल बना दिया, राइट। उसका नाम था कोविन, इसका नाम है यूविन। अब बच्चे को टीका लगता है, एएनएम ऑनलाइन उसको अपडेट कर देती है और वहां से हम लोग इसको डाउनलोड भी कर सकते हैं। अभी एक बच्चे ने बहुत अच्छी बात लिखी है, डॉक्टर उर्वी लिखती है ऑनलाइन एमसीपी कार्ड। यस, यू कैन से दिस इज ऑनलाइन एमसीपी कार्ड which does not follow open vial policy. Guys, BM. Now BCG, MR, these two vaccines under national immunization schedule, they do not follow open vial policy. There is another vaccine which is not under national immunization schedule but government was giving it for free, and that is COVID, right? So these three vaccines, now one student is asking, Sahil Shah, yellow fever. Beta, the vaccine, first of all, yellow fever is not under national immunization schedule. Second point, in India the yellow fever vaccine which we use is a single shot vaccine, right? It don't have multiple doses, right? I get this point many times. Many students say, sir, yellow fever, we do not give under government supply. It is in private supply, right? In some of the government institutions this is available, but this is a single dose vaccine which is available. It is not multi-dose, right? Now many students ask, what about JE live? It does not follow. JE live, it is an old vaccine under national immunization schedule. But JE killed, which is a new vaccine, it follow open vial policy. It follow open vial policy. Now, coming to guys, rash. If rash is starting from chest or back, it is chickenpox, right? So this is the classical pattern of chickenpox. Now, fever with rash. The rash started from back. This history is enough to tell you that this is a chickenpox. How would you manage the case? Immunoglobulins are the mainstay? No. In chickenpox, we do not give immunoglobulins to everyone. It is not given for treatment also. Isolation and symptomatic management of cases, yes, this is the mainstay. Vaccines, no. Antivirals are only given to high risk, like, or the severe cases, right? Not given to everyone. Not given to everyone. Antivirals are not given. Which antiviral is given? Acyclovir. Beta, acyclovir is not given to all cases of chickenpox. So isolate and symptomatic management, 4-5 days of fever and then rash, then scabs off, and that's it. But if the child is entering in pneumonia, right? अगर बच्चा निमोनिया में जा रहा है, कफ बहुत सिवियर हो रही है, बहुत ज़्यादा एडवांस डिजीज हो रही है, then acyclovir can be given, but routinely acyclovir is not given. Guys, this is a case of diphtheria. When you are managing case of diphtheria, बच्चों देखो सूडो मेम्ब्रेन है, ये भी सूडो मेम्ब्रेन पड़ा है यहाँ पे, ठीक है, ग्रेइश वाइट थिक मेम्ब्रेन पड़ा हुआ है, नेक स्वोलन है, राइट? In this case, diphtheria antitoxin given alone? No. Erythromycin? No. Yes. Antitoxin with antibiotic is given. Guys, I want to tell you, suppose this option is there and another option, diphtheria antitoxin, and instead of penicillin G, erythromycin is there. So antitoxin with penicillin, antitoxin with erythromycin. Now the WHO guidelines say antitoxin with erythromycin is a better option. Guys, earlier, penicillin only single shot was used, right? But now erythromycin is given. Now this is the case where we have a asymptomatic contact. Now we have to manage a contact of diphtheria. In this case, immediate administration of diphtheria antitoxin and penicillin G not needed, because diphtheria antitoxin is for cases, not contacts. It is for cases, not contacts. Guys, I assume आपको पता है, मैं आपको बताता हूँ एक बार. देखो, जब भी डिप्थीरिया होता है ना, in case of diphtheria, it is the toxin which is causing more harm. So if you have a case of diphtheria and you are giving only antibiotics, the antibiotics will kill the bacteria. But what about the preformed toxin which is causing harm, which is already there, right? So that is why both are given in case of a case, right? But whenever you have a contact, so contact means asymptomatic and there is no sign and symptom, there is no lab confirmation. In that case, we need to give irrespective of vaccination status. Even if the child was vaccinated 2 months ago, irrespective of immunization status, we have to give antibiotics, right? And which antibiotic? Erythromycin prophylaxis for 7 days. So how you manage? I'll tell you how you manage. So you have a case who came in contact. You have a person, you have a child who came in contact with a diphtheria case. First of all, you take the swab. You take the swab, send it for the confirmation. Then you send the child in quarantine, right? Quarantine is for contact. Isolation is for cases. You send the child in quarantine. Third, start erythromycin, irrespective of immunization status. I repeat, irrespective of immunization status. And fourth is, if the child is not done with immunization, then in that case you complete the immunization for diphtheria in that child. Now, a 3-year-old child presents with fever, rash, with fever and rash. There are spots. Beta, कौन से spots हैं ये? These are complex spots. Complex spots seen in measles. बच्चों, a 9-month-old, when you categorize fast breathing, if less than 2 months, more than 60, fast breathing. 2 to 12 months, more than 50 is fast breathing, and more than 1 year, or you can say 1 to 5 year, more than 40 is fast breathing. So in this case, option this is correct. Oseltamivir is recommended treatment for influenza. Guys, listen. Oseltamivir, I discussed this in my every face-to-face class and in my back to basic recording. Oseltamivir we give 75 mg for 5 days. If you are giving it for treatment, give it BD. If you are giving it for prophylaxis, right, prophylaxis, then you need to give OD, but the dose and the duration remains the same, right? But the dose and duration remains the same. Beta, in buccal mucosa, one child is saying that the child is confusing this with dew drops. नहीं बेटा, buccal mucosa में थोड़ी ना होंगे dew drop. ठीक है? In buccal mucosa, only complex spot. Guys, this question confused many of you. Okay, look here. Look here. Now, this is the site. This is the site for, first of all, many students thought this is BCG. Arey, BCG is given here, deltoid region. And this is given on triceps region. In triceps region, subcutaneous vaccine is given like MR. Deltoid region, intradermally. In deltoid region, intradermally, we give BCG. How this is BCG? This is MR. Look, this is the site. Plus, this child is not a newborn, around 9-month-old child, it looks like, right? So, guys, basics are important. Follow basics, right? So that is why I gave this question deliberately, right? It is MR. It is MR. A 6-year-old child presents with swelling in parotid gland, fever. All right, unilateral parotid swelling. This is the case of mumps. Which vaccine strain is given for case of mumps? Geralinin, right? Now, all right, beta, this case. What is pulmonary tuberculosis when lung parenchyma is involved? Other than lung parenchyma, extrapulmonary. Even pleura is extrapulmonary. Why we are dividing into pulmonary, extrapulmonary? Why, guys? Can anyone write in the chat box? Very good, Dr. Divya. This is the right hand. Good beta. Good use of common sense and good observing power. Why? Okay. Now you give answer here. Okay, so Bhavya is there, Urvi is there, Shivam, Zenith, Jyoti. बच्चों मुझे इसका आंसर बताओ. Why we are dividing pulmonary and extrapulmonary? Any special reason? Any special reason, beta? Guys, any special reason? The reason is this can be यहाँ पे स्पूटम यहाँ पे स्पूटम पॉजिटिव मिलेगा, ठीक है सर, हमने भी राइट हैंड बोला था। ओके बेटा, गुड, मैंने पढ़ा नहीं होगा आपका मैसेज, दिल पे नहीं लेना बेटा, दिल पे नहीं लेना, ठीक है। नहीं बेटा नहीं, पल्मोनरी टीबी it can infect others, extra pulmonary it cannot affect others, simple. Now so there is no drug resistance, TB का केस है, क्या दोगे? So basically this is drug sensitive. नहीं बेटा, treatment is same, भव्या, treatment is same, absolutely same treatment, right? In both treatment is same. For drug sensitive, we give 2 HRZE for 2 months and we give for 4 months HRE. So here B is the correct answer. Alright, interesting question. This is very interesting question and do expect this kind of question in your NEET-PG, right? Case based, story based questions. So H resistant, R Z E susceptible. This is a case of H mono. This is a case of H mono. For H mono, we give for 6 months levoflox, rifampicin, pyrazinamide and ethambutol. So C is the correct answer. Nikshay Poshan Yojana 500 per month. In account rupees 1500 every 3 months. So the rate is 500 per month, right? But for 3 months the amount is given together, like 1500, then after 3 months 1500, but the rate is 500 per month. Alright, this is interesting question. Isoniazide resistant, ethambutol resistant. So when H and E resistance, it is poly drug resistant. When only H, it is H mono. When H and R, it is MDR, right? So here the correct answer is poly drug resistance. Polydrug resistance. Which pneumoconiosis? Bachcho, silicosis. In DVT I also told you silicosis, right? Silicotics are prone to tuberculosis. That is why in silicotics we give TB preventive therapy. Alright, so these were the questions which were given to you in your daily telegram quiz, and now we are entering the section 2, images. These 5 images are very high yield images. This is VVM stage 1 and stage 2 you can use, stage 3 and 4 do not use. This is ice pack. This is ice pack, capacity 320 ml, right? And only fill with water, right? Only fill with water. Now this is even electronic vaccine intelligence network. This is related to the vaccine storage, and this is UVIN, we have already discussed. Bachcho, this is Koplik spot. बक्कल म्यूकोजा में दिखेगा कॉप्लेक्स स्पॉट, बक्कल म्यूकोजा. Now, are you ready for the rapid fire round? Guys, are you ready for the rapid fire round? Can I see some fire in the chat box? Can I see some fire in the chat box? Are you ready for the rapid fire round? Can I see some fire in the chat box, guys, quickly? All right. Now, vaccine not following open vial policy, BCG, MR, COVID, and if specially mentioned, JE live, not JE killed, but now JE live vaccine is not used. Vaccine not given after 1 year of age under National Immunization Schedule, BCG, Rota, IPV, Penta, PCV. TB treatment for drug sensitive TB for 2 months, HRZE. For 4 months, HRE. Indication and dose for varicella zoster immunoglobulin, pregnancy, immunocompromised, infant. Guys, what is the dose? Jaldi batao. Quickly, what is the dose? The dose is 12.5 international unit per kg. This is the dose for varicella zoster. Strain used for rubella, RA27/3. Intussusception is the side effect for after rotavirus vaccine. Diphtheria, contact management. Contact management for diphtheria, erythromycin for 7 days. Diphtheria case management, antitoxin and antitoxin plus antibiotic. Which antibiotic? Erythromycin or penicillin. Erythromycin or penicillin, guys. So we have done the wrap up. All the important points, all the important images, all the wrong questions we have discussed. Now check for block 4 schedule, which I'll be sharing in my Telegram group. And I recommend before sleeping, before wrapping up your day today, once go open your notes, open your DVD workbook and check for the weak area which you forget. Go for 10 minutes, just brush up. एक बार अपनी आंखों के आगे से निकाल लेना उनको, ठीक है, राइट? एक बार अपनी आंखों के आगे से निकाल लेना and you will be confident in this area, ठीक है? So this is for you. Focus on your weak area, open your workbook, open your DVD workbook, open your notes and just read, or maybe your 20th notebook, whatever you are reading from, and just read, just brush up your weak area. Sir, प्रोब का लाइव स्ट्रीम बेटा मैं दे दूंगा, प्रोब का लाइव स्ट्रीम दे देंगे. एक दो और अपडेट हैं जो मुझे बताने हैं आपको, राइट? वो दे देंगे. लेट मी फिगर आउट बिकॉज टुमारो विल बी हैविंग यूपीएससी रिकॉल and it will be on Dam's Denny YouTube channel. Tomorrow me and Dr. Siddharth will be doing UPSC recall. ठीक है, चलो बच्चों. All right, thank you so much, keep studying and if you have any doubt you may ask. All right, thank you बच्चों, thank you so much.